Welcome back to Breakfast Television, our chance to look at 20 years of a great legacy as the Provincial Health Officer. Dr. Perry Kendall is here, 5 days, retired, but still working hard. Welcome.
Thank you. Good morning.
Perfect timing to have you on the show to talk about the focus of conversation just recently about pot sales in public, private liquor stores. You had a strong recommendation on how the province should handle this. What was your view and why did you take it?
Well, my view and that of my colleagues and actually of the Cannabis Task Force was that we shouldn't be locating cannabis with alcohol or other addictive products like tobacco, that they should be separate. We saw no reason why you couldn't use the back office functions of the liquor board if you wanted to manage and license and do the wholesaling, but we felt that the retailing needed to be separate.
And why was it?
There are a number of reasons why. One is certainly in BC, just in the government liquor stores, they're really proud to have about in excess of 40 million customer visits every year. If you throw in the private retail sales, that would be tens of thousands more visits. About 80% of the population will drink alcohol during the course of the year. Currently, only about 17% of the population will drink cannabis or will use cannabis in the course of a year. So it moved it into a marketing situation where a lot more people who otherwise would not have come into cannabis, if cannabis is in liquor stores, they're going to come into it, into contact with it, and they may be tempted to use it. And part of the reason for bringing in a regulation was so that adults who are informed and educated and choose to can use cannabis without risk of legal consequences. On the other hand, we don't really need to over-promote or commercialize a product with psychoactive issues, which, while it has some beneficial uses, comes with certain problems as well. So why overflood the market? Why over-commercialize it? That was what we didn't want to see happening.
Well, it's a proactive approach with the recommendation, and when we look at the recommendations and harm reduction strategies you've incorporated over 20 years, the impact has been massive. One of the biggest topics of conversation is the overdose crisis.
Yes.
Over 1,400 deaths in 2017 with the chief coroner, but you've taken a philosophy of how we reduce the stigma. How do we truly create change with this problem?
Well, we have to think about it. I think we have to step back and think about it. If we talk about people with alcohol problems, they're not criminalized. We know that people can get in problems with alcohol, and we know it's not exactly something that people want to talk about. If we talk about people with nicotine, then with cigarettes, if you've got a habit with nicotine, well, it's socially not very acceptable, but we don't think people are failing when they try and quit. They may have to quit many times before they actually get successful, but they have the chances to do that, and we don't see them as criminals. We see them as people with a potential health problem, and we lean over backwards to try and help them. When you have problematic substance use or addiction to an illegal substance, you're not seen as somebody with a health problem. You're seen as somebody who has a moral failing or a weakness, or at worst, you're a criminal. And people get busted and arrested and get criminal records for possession. And so we don't see them as people with a health problem. They don't want to come forwards and talk about it. They won't talk about it with their workplace. They won't talk about it with their family. And when you look at the overdose deaths at the moment, 90% of those people who are dying are people who are using alone. They don't have anybody with them. They won't call 911. And probably part of this is because we have so stigmatized addiction, we don't put the treatment into it. We see it as a moral failing or a criminal issue.
Well, it's changing in the guard here in BC with you stepping aside after 20 years and now Dr. Bonnie Henry stepping up. What can Dr. Henry really do to carry forward the momentum that you've helped champion here in the province to help overcome this crisis?
Well, she's certainly going to do everything that I was doing in that file. I think as well she's going to be working on an issue which we were working on together, which is, can we move forward out of our comfort zone in some respects? There is a program to look at kind of non-therapeutic use of diluted pills, replacing a toxic, poisoned, illicit drug market with something which is safer. And that may indeed be a first step towards moving people into a more therapeutic regime, but at least people won't be dying because they've had a safe drug of a known quality. There's also the issue of working on drug policy federally as well as locally. Can we look more at the Portuguese model, where they decriminalized possession of illegal drugs if it was just for personal use, and put the resources that they've been putting into the courts into treatment and social supports and job training, etc. The result is that Portugal, after about a decade, had the lowest overdose death rate from opioid drugs in Europe.
Huge change right there. Well, we know you're retired. We know you're stepping away, but still an important voice here in our province. So, Dr. Kendall, thank you so much.
Well, thank you very much.
Appreciate having you come by.
Thank you.
All right, more to come here on BT. Stay tuned for more.